Our starting point this morning, a status update on the coronavirus situation here in South Korea. As of Wednesday, the 9,137 people in South Korea have contracted the virus, with 3,730 patients back at home after making a full recovery. The death toll here in the nation stands at 127. Despite the recent decline in cases in South Korea, the major worry now is that the country has seen a sharp uptick in the number of imported cases. One country of particular concern is the United States, and that concern has been reflected in a change in quarantine policy. Our Seung-jae starting us off.
100 new coronavirus cases were reported in South Korea on Tuesday, up from 76 a day earlier. Despite the slight rise, it marked the 14th consecutive day that there were 100 or fewer additional cases. Despite the optimistic numbers, the growing concern in South Korea is the rise of imported cases of COVID-19. Among the 100 confirmed cases on Tuesday, 51 were international travelers who recently arrived in South Korea. 29 were from Europe, 18 from the Americas, and 4 from Asia. So far, South Korea has reported 227 imported cases, totaling 2.5% of all cases. Reacting to the swift spread of the coronavirus in the U.S., South Korea has implemented tougher quarantine measures on those arriving from the U.S. According to a senior South Korean health ministry official, all passengers from the United States will be required to self-isolate at home for 2 weeks starting Friday, regardless of whether they are showing symptoms or not. If a passenger shows symptoms, they will be quarantined at a special facility for monitoring. The latest measures apply to South Korean and foreign nationals. On a brighter note, the number of coronavirus patients in South Korea who have fully recovered is rising fast. Latest figures show more than 40% of confirmed patients have been discharged from hospital. As of the end of Wednesday, 3,730 people in South Korea have overcome the virus, and the recovery figures have spread up over the past couple of weeks. However, the fatality rate has ticked up, with 1.4% of coronavirus patients in South Korea dying, up from 0.5% earlier this month. Patients in their 80s showed the highest fatality rate of 13.6%. Seung-jae, Arirang News.